Welcome, welcome, welcome. It's a pleasure to be here with you, truly. Actually, I regard it as a privilege. I'm Dr. Arnold Nerenberg, 82 years of age. I've been in practice in California as a licensed clinical psychologist since 1974. I'm going to be presenting a very important topic today with the idea of impacting you and your loved ones for the rest of your lives. The title of today's presentation is, do you worry a medical condition is killing you or a loved one? Do you worry that a medical condition is killing you or killing a loved one? As I said, I'm a psychologist. I'm not an MD. Anything I talk about physical health, medical issues outside of psychology, please consult your physician. I legally have to say that. I have many patients who are diabetic, hypertensive. I have some with cancer. One even has Lou Gehrig's disease, which is fatal. And it's on people's minds. And many of my patients, the average age of my patients is about 40 years of age. Many of them have a loved one, a parent, a grandparent, an aunt, an uncle, somebody that they're worried about who has a medical condition that they're worrying is going to kill them. I'm going to be mostly focused on when it's your own medical condition. You know, it used to be that if somebody was getting some symptoms, something was hurting, there was a lump or an irregularity on the skin, somebody would go, oh, I hope it's not cancer. You think you worry it's cancer. Or you have a cough that's not go away. People say, get a little worried, I hope it's not cancer, and they go see their doctor. Then when the COVID was at its worst, people would get any symptom. We didn't hear too much about people worrying about cancer. They were worried they had COVID. Gee, I think I had COVID. I think I have it. I'm having trouble breathing. I'm coughing. I'm getting a little fever. I have COVID. Now, these are normal things we're talking about. People get this. So I'm going to talk about my own health journey and how I've dealt with different medical issues. Because there have been definitely times in my life when I've been concerned, worried that there was a medical condition that was killing me, and how I dealt with it, and I've had a lot of success in dealing with it. These issues become even more important, more salient as you get over 60, but even before that, people start going, gee, I wonder if this is going to kill me. And it stays on your mind, if you have to go get some exam, something was a little suspicious, there's a little tumor, a little growth. See, I wonder if that's cancer. I wonder if I'm going to survive. You're going to get that, and that's in your mind. And a lot of the issue, a lot of the stress, anxiety, comes out of the uncertainty. Your blood pressure is running high. Often it's etiology unknown. You're on medication. You're staying off of salt, but your still blood pressure spiking up and down. And you say, I wonder if I'm going to get a stroke or a heart attack from this. And it stays on your mind. So I would talk about my own journey because I think I'm a good case history of having these issues at different times and dealing with it successfully. Now I'll show you what I've done in dealing with it. So let me first say that I was in my 40s. I remember feeling this tremendous pressure in my chest. It went through my whole body. I thought it was stress. A lot of times you can misdiagnose it, but I thought it was stress. I had a photography business with 100 employees. I was with my ex-wife. I was stressed tremendously with that relationship. And I thought it was just me going through a stress reaction and dealing with that. And I just felt it go through my whole body. My chest went through my whole body. Well, years later, when I had an EKG, they noticed that I had a heart attack previously in my life. Maybe 20 years later, when I had this EKG, I had to get it for some other reasons. So apparently I had a heart attack. It didn't even occur to me it was a heart attack. I didn't get it treated. I didn't go on medication. Didn't see a doctor about it. It didn't even occur to me I had a heart attack. Then when I was 61, kept getting this indigestion. Oh, I thought it was indigestion. It felt like this burning up, coming up my throat. So the doctors thought it was acid reflux. I took acid reflux pills. I wasn't getting any pain in the heart or anything like that. At the time, I was a power lifter. I was just getting big, not eating well, just eating a lot of food to just stay big and get strong, which I was. I was very strong, but I was not healthy. Well, up until I was 60, my weight was about 155. Then I started putting on weight to get big. I went up to 222, just eating, weightlifting heavy. Anyway, one day I was getting this, what I thought was acid reflux, wasn't going away. I started sweating. My wife said, we better get you to the ER. I said, I didn't really want to go. But we went. Sure enough, it was a heart attack. It was a very serious one. It was what's called the widowmaker, the LAD. That's a killer. Well, fortunately, I survived it. Gave me a clot buster. I got a stent put in and good to go. Never obsessed about it. Never worried about it afterwards. In fact, 4 years later, when I was 65, I set a world record, took the title strongest drug-free man in the world for my age and weight, kept working out. Never really obsessed about it. I don't even know if I was taking blood pressure medication. I got the stent and off I went. Pretty naive. So I went down from 222 to about 212 pounds. Well then, and I was drinking a lot of milk because I wanted that protein, and there's a good calcium and protein in milk, but also as the calcium protein causes breast cancer and prostate cancer. One of my doctors noticed a little cyst on my prostate gland, went for a biopsy. Sure enough, it was prostate cancer. And it was, so I wasn't walking around. Well, I was. When on my way over, I really, the way I dealt with it, I went, God, if you want this to be cancer, I want it to be cancer. Because the time you start being concerned, you start really obsessing about it, is when you're going to the doctors, when you're on your way to find out your diagnosis. Up to then, I really didn't think much about it. I wasn't worried it's going to kill me. Like, I didn't worry about a heart attack killing me. I sat down. He said, well, you tested positive for prostate cancer. It's not a little bit. It's an intermediate amount. It's somewhat aggressive, a Gleason of 7. That Gleason of 7 is somewhat different degrees of aggressiveness. So anyway, my face went numb. But because I'm trained in the way of honor, I used to call them power thoughts. After about 10, 15 seconds, I said, Doc, that's great. He said, well, what do you mean? He looked shocked. I said, this prostate cancer is going to make me stronger, spiritually, emotionally, and physically. And it did do that. I walked out. I saw the clouds, the birds, the trees, like I'd never seen it before. It was so beautiful, so exquisite. I didn't know how long I was going to live. I saw the people around me that were no longer strangers and other. I knew they looked at me as a stranger, but I just felt love for them. I wanted to go talk to them. And I really didn't worry about this killing me. Even though I had the prostate cancer, I was, I thought, God, if you want me to go, to leave this earth and leave, I want to go. If you want me to stay and serve you here, I want to stay. If you have no preference, I prefer to stay and serve you on earth. But I really did, I felt just, people were shocked how peaceful I was. I felt, well, I'm really, really more present, more grateful for just being here and the seeing that I have. And by the way, when I had the prostate cancer, I took the title strongest drug-free man for my age and weight, which included a bench press of 365, drug-free when I was 65. And then when I was being wheeled in, when I cut out my prostate, I did get stressed, was trying to figure out what to do. You get radiation, chemo, had a new system that they were using, or some kind of ultrasound in Canada, or just get a prostatectomy and get it cut out. So I did get stressed about what procedure I was going to use. Once I decided to do it, I wasn't stressed. Went to the hospital that morning. It was Cedars-Sinai in L.A. It was like a holy pilgrimage. I went there, joking with the doctors. They took out the prostate. Fortunately, it had metastasized, negative margins. They took out a couple of lymph nodes. I had to go to the lymph nodes, so it was good to go. Didn't really worry about cancer coming back or killing me. I mean, I got PSAs regularly every 6 months. Now I do it every year. And that's been 17 years ago. 17 years ago. Yeah. So up to, okay, so now I'm getting to be 67 years old. Up to now, I've never really been worried about something killing me or killing a loved one. Now, at some point, I think at that point, I had some concerns at some point about my mother dying of a condition. But I'm mostly going to focus on being concerned about our own medical condition. So I was okay up to that point. At 67, I started getting labile hypertension. My blood pressure, for unknown reasons, would shoot up to systolic to 200, 220. And anything over 190, you can go to ER and they'll admit you. And we couldn't find out why. It would come down, it would shoot up. I was taking all these medications. I couldn't get it under control, up and down. Didn't know what was happening. Now I started getting concerned. I had a medical condition that would kill me. And etiology, no, we didn't know what it was. It wasn't the adrenals. It wasn't my kidneys. Turns out that sodium was an aggravating factor, but wasn't the only factor. So I went off sodium. My wife figured out sodium was a factor and went off salt, sodium. And we're talking major spikes. So that's how I've developed an expertise on being concerned or worrying about a medical condition killing you. Now, going through this medical condition, it certainly increased and walking around, the medication, you get side effects. You don't feel 100% right from that. Also, you're getting blood pressure spikes. It goes up too high. I would go to ER once in a while just to make sure I wasn't going to have a heart attack. So that journey, and I should say recently, about 3.5 months ago, I was getting a burning in my chest. I thought it was my lungs or asthma or an allergy. Well, it turns out it was my heart. About 90% occlusion in 2 arteries, including the LAD, the Widowmaker. Went to Scripps. They put in some stents. Those symptoms cleared up. But my blood pressure became labile. Started jumping up and down. Etiology unknown. So some of the thoughts, following the way of honor really helps. And I'm defining honor as loyalty to your highest constructive values as enshrined in the 4 commandments of honor while striving to cause no harm emotionally and physically. The 4 commandments of honor are: I wish you well. I take full responsibility for co-creating my reality and my problems. I'm grateful for the power I gained from hardship. And then one of 2, either I seek always to serve my highest values, or if you believe in God as I do, God, your wish is my only wish. Now, when you have some of the derivatives of God, your wish is my only wish is, God, if you want me to pass away now, go on. I want that. If you want me to stay here to serve you, I want to stay. And if you have no preference, I prefer to stay. So that's a derivative of God, your wish is my only wish. And I use that. And I go, oh, God, if you want to take me, I want to go. Now, I will say this. For those of you who are spiritual, you don't have to be religious, but spiritual, you can spiritually look forward to going on to the next life. Assume if you believe you're an eternal soul, which I totally believe. Spiritually, I look forward to it. So that's one thing. I really look forward to going on, seeing my parents, my relatives, seeing the holy ones who have been here on earth over the centuries. Look forward enormously spiritually. But psychologically, we're really genetically wired to do everything we can to stay alive, which I'm doing. I'm following every practice: allopathic medicine, alternative medicine, exercise, weightlifting, walking, qigong, 5 rights to Tibetan yoga, everything to have longevity and vitality. So we have eternity on the other side of the veil here. I'm doing all I can to stay. The body, if we don't destroy ourselves, is geared for 120. I did a lot to destroy myself by wrong eating and wrong thinking when I was young, and my thinking now is really good. So I'm grateful for the power I gained from hardship, derivatives from that. What's the best true story I can tell myself about this problem? That's a very helpful one for this. And I intend to come back much stronger than ever. Or you can use, I hope to come back much stronger than ever. That's very healing, that thought. Also using, for those who believe in God, as I do, God, I'm extremely grateful for the gift of this medical tribulation that brings me closer to you. Because when you're going through hard times, emotionally, or in this case, medically, you turn to God more. That's a fact. That's universal. So I would say, right now, so my blood pressure goes up and down. I also have some breathing. I feel compromised breathing. I can walk. I don't get out of breath. But it feels like, I don't know what to call it, but compromised breathing. I don't know if it's my heart. A lot of times you don't know what it is. I don't know if it's my heart, my lungs, or a side effect of the medications. The doctors don't know. I mean, nobody's going to be able to, people can't answer these things easily for you. See, a lot of it, you put together a medical team, and they're your team. They advise you, and you make your decisions. And you can then meditate or pray for guidance. So I use, there's an awareness. Yeah. I wanted to go to 120. In my nuclear family, my immediate family, it wasn't long life. My father died at 64. I almost died at 61 of a heart attack. My sister died at 74. My mother died at 82. I'm 82 now. So if I get to 83, I've defied those genes of my immediate family. I have a cousin that died recently at 92. I have an aunt that went to 98. Some people have really long life. They can abuse themselves, do whatever, and they're going to go on to 98, 99 years old, whatever. So I was intending to go to 120. I'm following every protocol for a long, healthy life filled with vitality. And I have a lot of energy, a lot of vitality. There was a period about 4 or 5 months ago where I had to stop. I didn't look like I had the vitality. I had to stop walking every, 5 minutes. I'm walking every few minutes because I would get the burning. I thought it was my lungs or asthma or allergies. But now I don't have that. I can just keep going, walk, run, whatever, after I had the stents put in. But for a while, it looked like something, anybody around me could see, doesn't have the same oomph. And I had the energy, but I didn't want to keep pushing because of the burning in my lungs. Well, that stents in took care of that symptom. It took care of that symptom. My oxygenation level went up from 93 to about 96%. My pulse rate came down. But my blood pressure became labile, which so there's a stent put in. The first stents I put in were called bare metal stents out of titanium. This was called a medicated stent, which would elute medication to help prevent restenosis, closing of the stents. But it's a different metal. So I said to my cardiologist, is this metal, is it possible having a reaction to the metal? He said, I don't think so. But who knows? I tolerated bare metal stents, non-medicated. In fact, when I was getting these stents put in, I said, can I get the bare metal stent? And they said, no, that's not standard of care anymore. So I had to get a drug-eluting stent of a different metal. So it's unknown. So again, you're dealing, one of the parts about when you have these medical conditions, you don't know exactly what's doing what. You just don't know. And now that the uncertainty is something that a person can worry about. Although I have it as a background feeling, particularly if I'm having my breathing doesn't feel totally right, or I can feel if I'm sometimes people don't feel when their blood pressure is going up. I can feel it. My ears get warm. I feel some pressure in my head. I'll get a little angina, a little something over my heart. So I can tell. And I have a blood pressure gauge in my office, one at my kitchen table. I've got all these natural supplements and medications. And now with the medications, some of them make my brain feel like it's shutting down. And some of them I think interfere with the breathing. But I'm controlling my blood pressure. So these medications, the allopathic medications, work. They're wonderful. But also some of them feel like they're killing me, or I feel like it's killing me. These side effects, they're called side effects, but it's a poisoning. And so you just hope your body can adapt to it. And it's a trade-off, the benefit, the risk-benefit comparison. That's what it said. What's the risk and what's the benefit? So you stay on these meds. I'm on statin drugs again because if you get your LDL under 50, you're less likely to build up plaque. Well, it used to be when Dr. Esselstyn said, he had a book on it, he said if it's under 70, if your LDL is under 70, your cholesterol is under 150, you won't build up plaque. Well, my blood work was great. I mean, I developed 90% occlusion with great blood work, an impeccable diet and exercise routine, and still had 90% occlusion. The artery started closing up. So it could be genetically driven. Anyway, I'm never going to go off a statin again, but the statin predisposes you towards muscle and tendon injuries. I'm getting some issues with my knees around this. So you're navigating, once you start having some of these issues, particularly cardiovascular issues. I remember one cardiologist said, once a cardiovascular patient, always a cardiovascular patient. Didn't like hearing it, but it's true. I might get a year or two where I don't have to see a cardiologist. Then all of a sudden, things start acting up. So these are the factors, and I tried different medications. I titrate them. I know I reduce them. I stopped staggering with them. I became an expert on different hypertensive medications. I used to tolerate lisinopril, which is an ACE inhibitor. It relaxes the blood vessels. They can dilate. I was getting a sore throat from it. My throat was getting very hoarse. I went off of it. I used Divan and ARB, which blocks the hormone from constricting the arteries. I take that. I tolerate that well. Took hydralazine. Hydralazine made my brain feel like it's shutting down. I cut that in half. I took amlodipine, which is to make my breathing feel funny. I'm cutting that in half. So you start working with taking this, taking that, taking certain supplements, getting off those supplements, taking coenzyme Q10. If you take a statin drug, you've got to take coenzyme Q10. I take 100 milligrams of the of coenzyme Q10 3 times a day. Now, so it became, but it led to some humorous statement. I say people staying alive becomes a full-time job and became a hobby. So I've been able, so what's the best true story about this? That's one of the questions you want to ask when you're going through this. I'm able to help other people. I'm able to have compassion for what they're going through. I'm able, a lot of people be able to advise them what to do. Because, and I have no MD, I didn't study these things in school, I'm a psychologist, but I have so much experience on how to navigate it, that I'm able to I have to always tell people I'm an MD, talk to your doctor, then I tell them, I give them whatever I have to say about it. So I'm able to help people a lot. And I became an expert also on diabetes, the kind of medications that help. The power of metformin was a great drug to reduce insulin resistance. I don't have a problem with that, but if you bring your blood sugar down, a lot of things clear up. Like my A1C is 5.3, which is pretty good. And I take berberine, it's a natural herb, to keep it down, 500 milligrams 2-3 times a day. So if you keep your blood sugar down, because blood sugar will exacerbate everything, heart condition, any condition you have, it'll be a problem. It could even help contribute to elevated blood sugar, can contribute to Alzheimer's. In fact, Alzheimer's has been called type 3 diabetes. So again, do you worry a medical condition is killing you or loved ones? I'm certainly not concerned which of these conditions would kill me, particularly the label of hypertension, and sometimes the thing in the breathing, not out of breath, but it just feels a little compromised, very hard to even describe. And again, not knowing the cause, not knowing if it's medication, lungs, allergies, or heart. That's another thing. You get these symptoms, and you're not even sure where it's coming from. And the doctors are excellent what they do, but there's a lot they can't do. As a matter of fact, when I had the stents put in, when he told me it was 90% occlusion in 2 arteries, it was a relief. That's a nice little thing. Oh, you put some stents in, the arteries opened up, good to go. It's a lot better than, some valves, other things that could have been not as easily described. You can go in there and say, well, we didn't find anything. Something's a little suspicious, that's suspicious. What's causing this thing? So in a way, it was a relief that if you fall into a pigeonhole, your arteries are shutting down, oh, here's a cancer here. If we do a biopsy, it steps into something they can do something about. A lot of times you're going to have symptoms and say, we don't know what it is. Etiology unknown. So then you walk around. If you're feeling the symptoms, you wonder if this is going to kill you. I'll have long periods of time where it all lifts, and I don't think about that. But when you're feeling some symptom, it's in your mind. Now, what you need to know, it's in the minds of your loved ones. You might be concerned about killing them. They're even more concerned. They're walking around with that. And so you want to have a compassion that even they're not talking to you about it, in their mind, they're wondering, is this what's going to kill them? We all have this idea that we're going to die someday based on what we see around us, right? We're all going to die someday. So then you go, what's going to kill me? What am I going to die of? Is it this? Oh, is it that? So you wonder. Now, then you have to decide how you want to leave this earth. Now, for me, there's two things. I want to have a light come out of my eyes. It's kind of come out, a light of coming out. And also, I hope to be able to stand up and just dance my way out. I don't want to be cringing. If I can stand and do it, if I have enough time to do it, that's what I want to do. So you want to think about, okay, if your time does come, how do you want to leave? You want to have a plan on that. You don't want to be cringing and say, oh, no. You don't want to be in that position. Go for it. When the time comes, go for it. Fight it. Do everything you can to stay here. Time comes, you want to go with some dignity, dance your way into it, whatever it takes for you to go, feeling this is a good way to go. Again, physically, psychologically, you want to do all you can to stay. You don't want to die. Spiritually, it's a great thing to go on. Much better than being here. Every divine teacher has told us, if we had a glimpse even to the other side of the veil, nobody would want to stay here another minute. So I can say for me, I very much look forward to going on, and God willing, not too soon. I like to make it to 120 with a lot of vitality, but we'll see. So I'm giving you advice about how to die, how to deal with your worries about this. Now, even though I'll say, I hope to come back much stronger than ever, doesn't mean I don't start going back to some kind of, feel something's not right here. I can feel my breathing. I want a little bit of, not totally right. A little bit of those thoughts like that. You go, well, I intend to come back much stronger than ever. God willing. I'll use God willing at the end of that. I intend to come back much stronger than ever, God willing. This morning I hope to come back much stronger than ever, God willing. So these thoughts are healing. We can't help getting some of what you can call negative thoughts, worrisome thoughts. We didn't choose them, but we can then choose to balance it with honorable, positive, constructive thoughts. Positive, constructive, honorable thoughts. And the thoughts I've given you are the most powerful thoughts in the universe to balance it with when it comes to the medical condition. Nothing more powerful than that. Well, it's been my pleasure to present to you, do you worry about a medical condition killing you or killing a loved one? So I'm going to open up to any comments or questions. Ivan, any comments or questions you have?
No, I was just taking in the stress and anxiety part as far as the wonderment, the stress of the unknown that you were saying. And I can relate to that, not just in the death thing, but just in other things that I'm expecting to do or not really understanding what the outcome may be, the unexpected. So, yeah, it really applies.
Well, the uncertainty in life, a lot of things are uncertain in life. That can cause anxiety as well. So you need a constructive way to deal with uncertainty, but especially so when it comes to these medical conditions, because that's the ultimate thing. Is am I staying? Am I leaving? Am I staying or am I going? Thank you for that feedback, Bernice. Any comments or questions you have?
Yeah, I just wanted to say thank you for sharing. I think it's a good example and roadmap that you're giving us, that you're laying before us, to be able to deal with things with honor and dignity, which is not talked about. It's not common to have this open discussion. You know, I think a lot of people shy away from that uncomfortableness of the unknown surrounding health issues. So it's beautiful for you to share with us your experience, so that way we have some kind of blueprint, you know, to go off of.
Well, you know, I feel an obligation not only to show you how to live with honor, but how to die with honor. And by showing it by living that myself. Yeah, exactly. Thank you.
Yeah. Thank you.
Anybody else here that wants to say anything or ask anything?
Hi, Doctor. Can you hear me?
Yeah. Is this Christy? Oh, Tracy.
This is Tracy.
Oh, Tracy. Yeah. Good to see you, Tracy.
So I just wanted to say thank you for, sharing with us, the things that you've been going through, and pretty much preparing us in a way for ailments, because some people don't have others to listen to as far as someone of your age and, whatever ailments, or someone even listening to someone who's as healthy as you are and still having, troubles here and there. As for me, I would love it if my family members had a little bit more motivation into trying to gain better health for themselves. I got a call from one of my parents' doctors today saying that there was still, bits of cancer, and that we would have to make an appointment soon to get them removed. How it happened, of course we don't know, but I feel like there's things that we can do, the positive thoughts that you give, that if they're taken into us, that we can, actually kind of heal ourselves with positive thoughts.
Definitely has. It definitely has. At the extent that we become optimistic, optimism is associated with a better prognosis of all illnesses and all surgeries. Optimism. Yes, you're right.
Yeah. So, I wanted to share that and just say thank you.
No, you're most
sharing.
welcome. You're most welcome,
The last
Tracy.
bit, what I heard.
Well, let me tell you, first you know this. Most people don't really care about living a long life. If you say to people, do you want to live? They'll say, yeah. But just follow them around when they go shopping in the supermarket. Look what they put in the shopping cart. They know half those foods are going to kill them. They don't care. So you never go by the only way by what somebody says that they want to stay alive. Look at what they're doing. I know everybody I know who passed away died prematurely. My father knew he was killing himself. He was eating, getting bigger and fatter, and he died at 64. My mother was a smoker. That ultimately discouraged. She had 7 years of misery from 75 to 82 on her way out. My father-in-law, the doctor said, if you don't stop smoking, you'll be dead in 6 months. 6 months later, he was dead. When I had a heart attack at 61, I was eating. All the signs were there. I was in trouble. I just wanted to be strong. I put strength in my training before life. I did it to myself. And anybody I know of who died, for the most part, did a lot to add to, co-created that death. Absolutely. I remember I was sitting at a table. I've told this story before. I was sitting at a table at an outdoor cafe, talking to this guy. He said he had diabetes. His blood sugar was up to 300. He had his 4 kids with him at a table. I was with my wife. I was sitting there, and then his meal comes, and I see him get a big stack of pancakes, which just turns into sugar in your bloodstream, and he soaked it, drenched it in syrup, in maple syrup. I said, hey, bro, I don't want to interfere with your business, but didn't you just say you have diabetes? He says, yeah, I know I shouldn't, but I can't resist it. He went and ate it. His son afterwards came up and hugged me and said, thanks for trying to help my dad. He didn't care. He just wanted to enjoy it. A lot of people say, we all have to die sometime. I'm going to enjoy my life. So they smoke. But when I tell people, all right, I understand, but if you just die suddenly and you're gone, that's great. But a lot of times it's a slow way out. Strokes and heart attacks or cancers, it's a slow way out, and you're not going to enjoy that time. After my mother ended her health problem, she stopped smoking. I have another cousin of mine. He was a smoker, never stopped. Then he developed cancer and a heart attack, and then he stopped smoking. But a lot of the reasons that people die, it wasn't a priority. Now, for me, I have an obligation to my loved ones and to the honor movement that I serve to stay here as long as I can. And my intention is after I leave here to do what I can for everybody, for my patients, for the honor movement, for my family from the other side, to do everything I can. But I want to stay here as long as I can to get everything in place. And, if I get another 40 years or whatever. But one thing I should mention, you start wondering, if I make it to 83, well, that's good. I made it out. I beat my genes that way. But, I don't see myself dying before 90. So you can actually start, you go through numbers. You start saying, I should make it to 90, okay? So one thing you start happening when you start getting into these things with medical issues, you can start getting, as I do, into numbers. You say, well, got this much time. Now, people say, well, you have some of these issues. How come you're still working? I work all the time. I never plan on retiring. But what people don't know about me is when I'm seeing my patients, now get this is the truth. When I see my patients and they show me their vulnerability and their struggles and their tears, and that shows they have that trust in me to open up and let me see that. It's very intimate. To me, and I watch them struggle nobly with nobility to transcend what they're going through, to be a good person, an honorable person. When I see that, and this is the truth, that's more beautiful to me. I was just telling that to Bernice today. That's more beautiful to me than the most gorgeous sunrise, the most gorgeous sunset, the most beautiful work, Michelangelo, any statue, any painting, anything in this world. Nothing's more beautiful to me than that. I'm like, wow. So I see the beauty in the people. Now, if I met these individuals at parties and were just chit-chatting, I wouldn't see it. I wouldn't just chit-chat, about nothing. People talk about typically nothing at these parties. I don't go to parties for that reason. But people allow me to really see them, the inner person. And it's magnificent, the nobility of the people dealing with what every human being deals with. Oh, why would I want to not do that? Why would I want to retire? To behold beauty from morning till night every day. And then, of course, when you see that beauty, I feel so much respect and admiration and love, and I have compassion, and I'm able to offer wisdom and guidance in there. Wow. But the beauty of what I behold, and I often wish that people could see themselves through my eyes, because the beauty I see in their struggle and their nobility is, I'm a poet. I don't even know if I could, I don't know if I can capture it in a poem. I should try. I should write some more poetry about it. It's exquisite. I get to see the nobility of the human spirit all day long. Wow. To be honest, I don't have something better to do than that. What is there better that I could, what can I possibly do better than that? To see that, be a part of it, to be a witness and a guide in that. What could be better? Go to movies, take cruises. I take so many cruises, trips, movies. How much of that? So I would say also having a strong sense of purpose adds to your vitality, your energy, and to your health, and to longevity. So whatever medical condition you have, it also gives you a way to go beyond your medical condition, because you're now focused on the the needs of someone else. You're serving someone else. Gets you outside of worrying about, is this killing me or not? You're there to really give to this other person. Anything that can get you out of yourself that way, it's good medicine. Well, it's my pleasure to present to you, do you worry a medical condition is killing you or a loved one? Thank you very much.
The sea of destiny is in your deepest struggle. God's will and mine be one, and I wish you well. You are co-creator, respectfully real. There's a way in the valley that turns weakness to steel. We're known through all eternity, from strife we gain power, clothed in grace and love, disciples of honor. All the days of our lives refuse the way of shame. We wish nobody harm, have no one to blame. Your high calling will be done, and pure eyes now glow. In darkness crave the good, like waters from the desert flow. I pledge my love all the days of my life. I pledge my soul to all that is good. I pledge my heart to my brothers and sisters, who I join in the light, leave a legacy of honor. We're known through all eternity, from strife we gain power, clothed in grace and love, disciples of honor. All the days of our lives refuse the way of shame. We wish nobody harm, have no one to blame. Your high calling will be done, and pure eyes now glow. In darkness crave the good, like waters from the desert flow.